Natalie. I'm going to be your nurse today. I'm going to be doing a physical assessment. Okay, can you state your name and last name?
Alex Alexandrov.
Okay, and where are you today?
Harper College.
Okay, and what month is it?
November.
And who's the president?
Trump.
Okay, so I assessed your cognitive function, which is ×4, and I assessed your level of consciousness. You were alert and awake. We already did the Snellen test, testing your cranial nerve number 2, and we also got your height, weight, and I calculated your BMI and your vital signs, which is respiration, heart rate, blood pressure, and SpO2. I am then going to move down to your head and face. I'm looking at the size and shape of your face. I am then going to palpate your scalp all the way around, and I am inspecting. I'm going to take out your hair, so we're going to inspect your hair. Okay. And I'm going around the whole scalp, inspecting her hair and scalp. Okay. I am then going to palpate your temporomandibular joint. Ready? Good. Okay. So if you could open up your mouth and close it. Okay. And then I'm going to palpate your maxillary sinuses and your frontal sinuses. Okay. I am then going to test your cranial nerve number 7. Can you smile? Can you frown? Can you lift your eyebrows? Close your eyes? Okay. Now I am going to move on to your eyes. Let me get this. Okay, I'm testing cranial nerve 3, 4, and 6. I'm going to do the 6 cardinal positions of gaze. So you're gonna look at this and follow my movement. Okay, I'm gonna test accommodation. Okay, I'm testing cranial nerve 3, 4, and 6 again with light reflex. I'm gonna cover one eye. And then other side. Hold on. Is it on top?
This one. Just press this.
Oh, okay. I'm testing light reflex. Okay, and then I see that it's Perla, which is pupils are equal, round, reactive to light, and accommodation. And I'm going to look in your sclera and conjunctiva. Okay, and now I'm going to move on to your ears. I am palpating the external part of the ear and the auditory medius, and I am inspecting the skin characteristics. I am palpating the external part of the ear and the auditory medius and inspecting the skin characteristics. I am then going to test your cranial nerve 8, which is the whisper test. So I'm going to say something and then you just repeat it.
Blanket.
Blue blanket.
White blanket.
Yes. Okay, and then I am going to test your nose or inspect your nose. So I'm going to palpate for symmetry, any tenderness, pain, which there is none. And then I'm going to test your patency. So can you inhale and inhale. I'm going to inspect your mouth. I'm looking at your lips, and it looks good. And I'm going to have you open up your mouth to inspect your mouth and throat. So you just push down. Okay. You can open up. Okay, so I'm looking at the buccal mucosa. I'm looking at the teeth and the gums and the tongue and the uvula and the tonsils. And if you could lift up your tongue, lift it up, the floor. Okay, so then I am going to have you do, I'm going to do your cranial nerve number 9 and 10. So if you open up and say, ah. Okay, and then cranial nerve 12, can you stick out your tongue? Okay, so then I'm going to move on to your neck. So I'm assessing your parotid glands, your salivary glands, and your, lift up, your thyroid glands. I am then going to palpate your lymph nodes, which I'm doing on both sides, but it would be preauricular, posterior auricular, occipital, submental, submandibular, jugular digastric, superficial cervical, and deep cervical chain. And then you can turn this way, the posterior cervical. And then I'm doing the subclavicular lymph. And if you could raise your shoulders a little bit, yeah. Okay, I am then going to assess range of motion. So if you could put your chin down Yeah, and then back, and then ear to shoulder, chin to shoulder, chin to shoulder. And I'm going to test cranial nerve number 11, testing strength. And here. Okay. I am then going to palpate the carotid artery one at a time. Okay, and then the other side. Okay, and then I'm going to auscultate with the bell of the stethoscope, the carotid artery. Okay, and I would instruct the patient to hold their breath. So if you can inhale and hold your breath. Okay, and I'm going to do the other side. Exhale, inhale. Okay, now I'm going to move on to the upper extremities. I'm looking at the skin color, characteristics, and for any lesions on the skin. I'm going to assess the temperature. Okay, and then the radial pulse. And then the other radial pulse. Okay, I am then going to assess each finger and palpate and inspect. And then I am looking for profile sign. Okay. And then I'm going to do capillary refill. Okay, and I'll do it on the other hand, the capillary refill. And then I'm going to move on to range of motion. So if you could stand up, I'm going to do your shoulders first. So if you could bring your arms this way and then back behind you. Then start your side, all the way up and behind your head, all the way down and behind your back. Okay, and then I'm going to test strength. So if you could lift up. Okay, now we're going to do your elbows. So if you could flex, extend, and then bring them this way and turn. Okay, and then turn back, and then we're going to do straight. Okay, and then if you could push against. Okay, now we're going to do hands. So start off flat, then down, flat, up, fingers, and then go back down, just your fingers and come up, and then strength, and testing strength again. Okay, moving on to the chest. So if you could sit down. I'm first gonna assess your chest. I'm looking for any accessory muscle use on the anterior side in the skin, and I'm gonna look on the posterior side as well. And I'm noting rate and rhythm too when assessing. I am then going to listen to your lungs using the diaphragm of the stethoscope. Okay, so if you could inhale, and exhale, inhale, exhale, inhale, exhale, or inhale. Okay, I'm then going to do the posterior chest listening. Okay. Okay, and then if you could, I'm going to have you do your left lateral, so if you could lift up your arm. And then we're going to do your right side. Okay. And then I'm going, since I listened to your lungs, I would hear the bronchial, which is high-pitched breath sounds here. And then bronchiovestibular is going to be in the sternum, which is moderate. And then vestibular, which is low breath sounds, is on the peripheral side of the lungs. And then here you'll hear bronchiovestibular, which is moderate here, and vestibular, which is low on the peripheral side. Okay, so then we're going to do jugular venous distension. So I already adjusted the head of the bed to 45 degrees. I'm going to have the patient move your neck this way, and I'm looking for a venous distension, which I do not see any. So then I'm going to move on to the heart. So I'm first assessing and looking at for any pulsations, anything like that, and then I'm going to listen with the diaphragm of the stethoscope. I'm gonna start, with the pulmonic, or the aortic. So this is the aortic, and I'm just listening. Pulmonic. Okay, tricuspid. And mitral. And then I'm going to listen to the apical pulse and note rate and rhythm. Okay, I am then going to use the bell of the stethoscope and do aortic, pulmonic, tricuspid, and then mitral. Okay, I am then going to move on to the abdomen. So I'm going to lay the bed flat. Okay, so the first thing I'm going to do is I'm going to look at the contour. So I'm going to go on the side, and then for symmetry I go to the bottom of the bed and look for symmetry. Then I'm going to assess the stomach and the umbilicus, looking for any pulsations and for any discoloration, and it looks good. So then I'm going to auscultate and listen to the diaphragm, the 4 quadrants. Okay, and then with the bell, I'm going to listen to the aortic artery and the renal arteries. Okay, and then with light palpitations with 3 fingers, I will do the whole abdomen, palpating. And then with deep, okay, then I'm going to move on to the lower extremities. So I'm going to assess the legs for color, texture, and any lesions. I'm then going to assess the temperature all the way down and palpate for any edema. Okay, I am then going to feel for the dorsal pedal pulses. Okay, I am then going to do capillary refill. Okay, and then I'm going to move on to range of motion. So I'm going to first have you lift your leg for strength for 5 seconds. 1, 2, 3, 4. Oh, sorry, I should be holding it. Maybe you could hold it up. 1, 2, 3, 4, 5. Okay, down, and your other one. 1, 2, 3, 4, 5. Okay, now we're doing range of motion of your hips. So if you could, this one out, then in, and then this one's going to go up, in like this. Out, side, and then down. We'll do your other one. So out, and up, side, and then side. And then we're going to be testing strength. So if you could push, and push this way, and push out, and then push in. Okay, so now we're going to be doing the knees. So if you could, or actually we're going to do the feet first. So we're going to do the feet. So if you could pull, push, okay, and then put your toes together. And then your toes out with your heel, and then inward, and then out. Okay, and then if you could come up over here, and you could stand like this on the side. So you could hold that, we're gonna do your knees. Okay, so if you could go out, and then in, then out, and in. And we're testing strength of your knee, and then in, out, in. Okay, so now we're gonna go on to the neurological. So I'm gonna do light sensation first, so if you could close your eyes and say now when you feel it.
No, 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 no.
Okay, and now we're going to do sharp or dull. So this is going to be sharp, and this is dull.
Okay.
So,
Sharp, dull, 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 sharp, dull.
okay, so then we're going to be testing your cerebellar function. So you could put your finger to your nose and then touch my finger and do it again. And do it again. And we're testing cerebellar function with your heel to shin, so like this. And then on the other side. Then we're going to be doing deep tendon reflexes. I'm going to do your bicep reflex, which I will find the tendon right here. Okay, and then I'll do your other one. Find the tendon. Okay, and then I'm going to do the patellar reflexes. And, okay, then I am going to do the Bambinski. So if you could lay down, and on each foot I'm going to do a J. Okay, then I'm going to do the Romberg test. So if you could stand up and close your eyes for 5 seconds. 1, 2, 3, 4, 5. Okay, so then if you could come over by me, and I'll have you walk that way. And then come back to me doing heel to toe. And that was assessing gait and heel to toe. Okay, then I am going to check your spine. So I see that the thorax is convex and the lumbar is concave. And then if you could, and I'm looking for straightness, and if you could bend over, touch your toes, looking for spine straightness, and then range of motion, keep your hips still like this and move this way. And then that completes the assessment.